guys. Dr. Stephen Greenberg along with Dr. Jacqueline Ross. Coming right here from our Manhattan office. Well, we're not actually in the office. We're actually on the street corner outside of our offices here in Manhattan. So we're seeing tons of patients. And what we do here in Manhattan is we see consults. We see injectable patients. We operate here. You did a bunch of cases. What did you do today? In the city office.
Quad lift, so that's an upper and lower eyelid lift at the same time.
Right.
Got to do that right here in the office for the patient.
And breast lifts and breast augmentations and facelifts and all sorts of procedures we do here. Now, it's also very common, and we'll get back to your eyelid lift in a second, but it's also very common to do injectables here in the city, and we do tons of Botox and fillers, and I think it's an art, right?
Definitely is an art. You want to go to an experienced injector. There's so much more than just sticking a needle and filling areas. You want to make sure your anatomy is right, that you have the right kind of filler depending on the anatomy that you're injecting, and that you just have a good artistic eye. These things really matter.
Yeah, it's not just putting the product in and putting Juvederm or Restylane or whatever in and putting Botox or Jeuveau or whatever. It's a matter of designing where the product goes. Picking the correct product is so important. And there's no downtime with this.
Nope. I've had patients come in, get their lip filler over lunch, and then they're back in the office. Maybe a little bit bruised, they put on some lipstick, and they're all good to go.
Yeah. So it's very, very common. People run over in between whatever they're doing. When they're out and about, we do a lot of their fillers, a lot of their Botox, and that works really well. So let's talk a little bit about your eyelid lift that you did today. You did an upper and lower eyelid lift, right?
Yes.
And the upper eyelid lift gets rid of all this extra skin.
Yep. It also gets rid of, if you have any puffiness to the upper eyelid, particularly on the inside of your eye, there's usually a little fat there that we can take out or just tighten. So it helps with that puffiness, and then mainly getting rid of any excess skin that's drooping there.
So I have a little extra skin in my upper lids.
We're going to do Dr. Greenberg right after this.
Exactly. And the upper eyelid lift, I don't know if you guys can hear me, but the upper eyelid lift gets rid of all this extra skin here. We make an incision in that crease of the upper eyelid, and it allows us to remove all this skin and a little bit of fat puffiness there. It takes years off of someone's appearance.
Absolutely.
Now, how about the lower eyelid puffiness?
So the lower eyelid puffiness is the same. It's little fat pads that we all have. They're usually held back by a nice little wall called your septum. As we get older, that septum or that wall weakens and the fat kind of pushes on it, causes it to bow out, and it looks like a puffy bag. We get rid of that by doing a no scar incision on the inside of your lower lid. We remove a little bit of that fat, and again, we tighten that wall to get rid of that puffiness. And it helps significantly to make you feel younger, refreshed. You look more awake to everyone. So it's one of my favorite surgeries to do. We can also combine it with a little CO2 laser to help with the texture of the skin of the under eye if you have kind of that creepiness of the skin too. So often in combination.
Yeah, I think that's a really good point. We often use the CO2 laser on the lids. We use it on the face. It helps to smooth everything out. So fine lines and wrinkles, texture of the skin. And it really makes, the CO2 laser really makes a big difference in facial rejuvenation processes. Now, not only do we do injectables and facelifts and eyelid lifts, etc., here in the Manhattan office, but also all sorts of body contouring as well, whether it be breast augmentation, liposuction, tummy tucks, whatever, in concert with facelifts, eyelid lifts. We can do bodies. So there's tons of stuff here. We're in the Manhattan office today, right here on Park Avenue and 72nd Street. We're actually standing on the corner of Madison Avenue and 72nd Street. Dr. Ross, myself, Dr. Weissler, who's just been operating all day and he's still operating, and Dr. Cooper as well. If you guys want to come on down, we're happy to see you. If you have any questions, just direct message us. Any questions coming through now?
How do I know if I need a breast lift or a breast reduction?
Question is, how do I know if I need a breast lift or a breast reduction? Depends upon the size. They're actually the same procedure, right?
Exactly. Yep. So reduction includes a lift. So it's really how big is your breast and how much smaller do you want to be. If you like your size and you just need your nipple lifted, then we're talking about a breast lift. If you want to be a little bit smaller, then that's a reduction. And just remember, your nipple gets lifted in a breast reduction. So same terminology, just different goals. One of them is to raise, one of them is to raise and make you a little smaller.
Yeah, and sometimes we put implants in at the same time.
Yep. You can definitely do that with your breast lift if you want more volume as opposed to less.
Okay, so that's, any other questions right now?
How much downtime after my tummy tuck surgery?
How much downtime after a tummy tuck? I usually tell patients to take a week off of normal activities. Can be, 8-9 days, but a week is pretty much safe. But no heavy lifting or working out for 4 weeks after a tummy tuck. But we get patients walking around doing things right away, and if they work from home, you can go back to normal activities within a day or two. So it's pretty simple and quick after a tummy tuck. Just no heavy, strenuous activities. Any other questions right now?
What's your best tip for healing scars?
Tip for healing scars.
So my first tip is let it heal. So after an incision, you should wait 2 weeks before we're doing any scar treatment. We want that skin to be completely healed first. Next, the big thing that we have that's scientifically proven to help with scars is going to be silicone products, whether that's a cream or a silicone tape. Depending on the area of your incision, I'll recommend one of the two and help you to get on a process of being prophylactic about our scars so that you get the best possible outcome.
Yeah, and sometimes we inject them with certain steroid solutions. Sometimes we, in our med spas, we laser them. So there's all sorts of options that we can do for a scar revision, laser injections, or just a simple scar medicines that we can prescribe for you. Any other questions?
Can I get liposuction done at the same time as a tummy tuck?
Can I get liposuction the same time as a tummy tuck? Often patients do liposuction the same time as tummy tuck. Super common combination. We certainly contour the waist at the same time, and sometimes the inner and outer thighs. And sometimes we even add cellulite treatment.
Yeah, so we do have cellulase, which is a laser that goes through the same tiny incisions as the liposuction port. And it helps to tighten your skin and tighten the tissues underneath the skin to prevent that dimpling that we all get with the cellulite when we have a little excess fat. So a great combination procedure to add to your liposuction that's pretty much always included with our tummy tucks for better contouring.
Yeah, great combination, liposuction with tummy tucks or liposuction alone. We also have, as Dr. Ross just said, cellulase to treat your indentations, and J-plasma Renuvion to help tighten the skin. Any other questions?
Can filler be done in the laugh line and under eyes?
Absolutely. Filler is done in both of those places really well. So filler works in a variety of places. I'm going to use Dr. Ross as my model, even though she doesn't need anything. She's perfect just the way she is. So Botox is not filler, but Botox for the forehead wrinkles to get rid of those, the glabella, the 11 lines, and the crow's feet. So that's Botox, Jeuveau, any of those neuromodulators. Fillers work in the laugh lines. You don't have any laugh lines because you're young.
So young.
The laugh lines, the marionette lines down here, fillers great. Sometimes we'll contour the chin area along the jawline, the cheekbones, bringing out the chin itself. Sometimes we do what's called a non-surgical rhinoplasty. So fillers can work in a variety of places to help rejuvenate the entire face. Any other questions?
Which filler do you recommend for lips?
For the lips, we like to use either Restylane or Juvederm for the lips, right?
Yeah.
And it's all about natural.
Yeah. Usually you want to use something that's a little bit softer in the lips. And so we'll choose the right product for you. Just like any place on the face, we're going to choose the right product because they're all a little bit different as far as their stiffness and what properties they bring to that anatomic area.
There are so many different products available. We stock them all in all of our offices. And what we do is we kind of individualize this. So we'll pick the right product for the right patient in the right area of the face. Any other questions? Only in New York.
Can tummy tucks be done laparoscopic?
No, they cannot, because a tummy tuck, we have to remove the extra skin. So we need to make an incision, and remove and pull down all that extra skin. So we cannot do it laparoscopically.
How do I know if I need Botox and masseter?
In the masseter, so this is a hot topic these days. We do a lot of masseter Botox, much more than ever before. And why don't you talk a little bit about that?
So it's best for people who have fullness right here at the angle of their jaw when you have a more hypertrophic or thicker muscle there. By injecting that, it slims down that muscle, so it gives you a more sleek jaw contour. That's the cosmetic reasons to do it. It's also helpful for people who may grind their teeth at night or have what we call bruxism, to kind of weaken that muscle a little bit so that you're not constantly on tension. So it can be functional as well as cosmetic.
Absolutely, and it slims the face, right?
It does. It gives a much more feminine jaw that's pretty snatched. I like it.
Yeah, works really well.
Yeah.
Any other questions?
Do you do hip dip fillers?
Yes, all the time. So what hip dip means is that indentation kind of on the side here in your hip area. Some people get a little bit of a dent there. So sometimes we'll put filler in the butt, and sometimes we'll put filler in what we call the hip dip. So we use fat. We purify the patient's own fat with some liposuction, purify it, and inject it in to either make the butt better or to contour the hip area. Okay, so if you guys want to come down and see us, we're happy to see you at any of our offices. Go to greenbergcosmeticsurgery.com or just direct message us right here, and we are happy to see you. Have a great day, everyone.